Hi, I'm Dr. Carreen Pakrasi, Director of Ophthalmology in Medanta, Gurugram and Delhi. The topic that we are discussing is visual impairment. The most common cause of visual impairment in India is still cataract. This is a very easily treatable disease and can result in complete recovery once you get the surgery done if you don't have any other problems. Also, glaucoma remains one of the most damaging diseases of the eye, where people can go undetected for a long time and lose their peripheral vision. Another kind of visual impairment that we find in elderly people is macular degeneration, where due to age there is an underfunctioning of the cells in the retina, which causes some permanent damage and can lead to very poor vision. Otherwise, you can also have some damage to the retina and the visual function in diseases like diabetes and hypertension. In children, you can get vision impairment due to lack of proper correction at the right time, which can lead to amblyopia. This can be permanent if you don't treat it properly and in time. Macular degeneration, as the name suggests, is a degenerative condition that happens in the retina, and more specifically in the central part of the retina, which has the maximum number of seeing cells and the maximum ability for acuity. Vision acuity is what gives us our central vision, and in macular degeneration, the cells get affected and our central vision goes down. This can be due to various causes like dietary insufficiencies, or maybe people who smoke and they have vascular conditions. Sometimes it can be due to any other circulatory problems. So people who have macular degeneration will complain that their vision is distorted. This distortion is caused due to fluid which is collected in the layers of the retina. When we detect it, we can treat it with injections as and when required. Lazy eye or amblyopia happens in children when they have undetected or late detection of a requirement for glasses. Children must get checked up when they start going to school to see whether they have a requirement for glasses. Usually, children who have hypermetropia may not show any signs that they need correction, but they may have the inability to focus with either one or the other eye. And this inability to focus with one eye, whereas seeing well with the other eye, will cause deprivation in the eye that is not seeing and lead to maldevelopment of the visual channels in that eye. So this is a condition that can be treated if you detect it early and you give the child glasses. Once you give the child the glasses that they need, you have to follow them up frequently to make sure that they are improving with the glasses. If they are not, they may have to undergo patching in order to increase the focus of the eye that has underdeveloped till that age. We often have parents come and tell us that the children who have a need for glasses is rising because of the fact that they are on the computer too much, or they're working too many long hours on the computer doing homework and all kinds of projects, or playing games or watching movies, and they feel that the amount of visual disability in children is going up. However, I don't think that this is something that happens. Earlier, people used to read more, and even when you read, it has been seen that children who stay home and read a lot have higher incidence of myopia. children who go outside and play often show an arrest in their myopia. So if you make your children stick to a schedule where they read, play, work on the computer in equal parts, you will find that they also will be able to arrest their myopia, and at least, if not arrest, because sometimes myopia is because of the growth of the eyeball, but this also has been shown that people who play and run around a lot have an arrest of their myopia. And so if children have a good regime and a good routine every day, I don't think that this is a real fact that the amount of children with visual disabilities is increasing.